Hey guys, it's me, Dr. Ree, and in this video we are going to talk about orienting yourself to the language of human anatomy. From this day on, when referring to specific areas of the human body, the picture I want you to keep in mind is a universally accepted standard position called anatomical position. In anatomical position, all joints are in a neutral position with the feet slightly apart, head and toes pointed forward, and arms hanging at the sides with the palms facing forward, aka forearms supinated. You can remember supinated like a hand cup you can make when you put your hands together with your palms forward and you can drink soup out of them. There are specific terms we use to describe the body surfaces. You can divide the body into two major divisions. The axial body relates to the head, neck, and trunk region. The appendicular body refers to the limbs and their attachments to the axial body. Now, let's label this picture with some body landmarks you should be familiar with. This is not an extensive list. Refer to your lecture notes and/or textbooks for a full list. The cephalic region involves the head, and some parts of that include the frontal, which is the forehead, buccal, the cheek, mental, which is the chin. We also see on the shoulder that can sometimes be referred to as the acromial region, as you can see here, the very tip part of our shoulder. When we come down the arm at the upper extremity, right here where we have our biceps and triceps, that is known as the brachial. When we go below into our forearm region, that is known as the antebrachial. At our wrist, we call this the carpal region, or these are where our carpals are, and our hand is known as the manus. When we look at the thumb is known as the pollex, and the fingers are known as digitals. The area in the center of our chest is the sternal region, and on either side is our mammillary regions. Our armpit is known as the axillary region, and where our stomach is, or our belly, that is our abdominal region. And our belly button is the umbilical region. The groin area is the inguinal region, and where our reproductive organs is our pubic region. The hip is known as the coxa or the coxal area. Our thigh is femoral. The knee, the front of the knee, is the patellar region. And from our knee to our ankle is known as the crural region when we look at it from the front. The ankle is known as the tarsals, and the foot itself is known as the pedal, like the pedal of a bike. When we look back at the head in the cephalic region, we also have otic, which means ear, and occipital, which is where the skull meets the neck. Scapular region is where our shoulder blades are, and the vertebral region is where our spine is. When we look down here, our gluteal region is going to be where the glutes are, and then the back of the knee is known as popliteal. The back of the leg from the knee to the ankle is the sural region, and right there at our heel, that is known as a calcaneal. Now, when describing how landmarks like these or how other various parts of the body are oriented, we use specific terms. These are like cardinals on a map, but instead of north, south, east, and west, we use terms like superior, inferior, anterior, posterior, medial, and lateral. Medial meaning close to midline, so you can see this line that I draw right here, and lateral being away from it. Cephalad and cranial. Cephalad meaning toward the head, and caudal meaning towards the lower extremity. Ventral is the belly side, and dorsal is the back side. Proximal, we use proximal and distal when we're talking about limbs. So proximal is closer to the trunk and distal is farther away. Now, when looking at the body, we can also divide it into sections via body planes. There are three main types of body planes. Coronal or frontal separates the anterior aspect from the posterior, the front from the back. That's what you can see that I'm drawing right here. Then there's transverse or horizontal that separates superior from inferior, top from bottom. And then there's sagittal or parasagittal, which separates left from right. Now, sagittal doesn't have to be straight down the middle. It can be over a little bit more to one side or the other. But when it is straight down the middle, we call it mid-sagittal or a median plane. And that's right down the middle of the midline. A majority of organs within the body are divided into compartments via body cavities. The dorsal body cavity is subdivided into the cranial and vertebral cavities, and the ventral body cavity is divided into the thoracic cavity, which is superior to the inferior cavity, which is the abdominal pelvic cavity. This cavity is divided into the abdominal and the pelvic cavities. The abdominal pelvic region is pretty big. So when describing, you can divide it into 4 quadrants, with 2 upper and 2 lower quadrants. Or you can divide it into 9 different regions, which are as follows. The right hypochondriac region is where we can find the lateral part of the liver and the gallbladder. The epigastric region houses the pancreas and parts of the stomach and liver. The left hypochondriac houses the spleen and the stomach. The right lumbar has the ascending colon of the large intestines. The umbilical region has the majority of the small intestines. The left lumbar region houses the descending colon of the large intestines. The right iliac region houses the appendix. The hypogastric region has the urinary bladder, and the left iliac has the start of the sigmoid colon. Knowing these regions and the organs is super important for an exam, but also super important for life. So let's apply what we learned to a case study. Now, your roommate is 21 years old and spent all night partying, which is not uncommon for him. You wake up to him hunched over, puking profusely. He looks at you and points to this region and says it's the worst pain he's ever felt. It's as if someone was taking a sword and poking it through his stomach. What region is he pointing to? And what organs can be found in this region? Well, this is the epigastric region, and let's think about maybe the pancreas. He's rushed to the hospital and they perform blood tests. The blood tests come back and they show an increase in digestive enzymes like amylase and lipase in his bloodstream. His diagnosis is acute pancreatitis, which is when the pancreas starts digesting itself. Common causes include alcoholism, taking too much Tylenol, or viral infection. Now, what if we had everything the same, but he pointed to the right iliac region? We would think appendicitis, or say your roommate wasn't a male, it was a female, and she just finished her menses a week and a half ago. Maybe it's ovulation pain. See how important location is? Knowing where things are is one step closer to solving mysteries and understanding the body. This video is for educational purposes only, and the information provided is not intended to diagnose, treat, cure, or prevent disease. If you have any questions, please contact me via email or come to Open Lab Thursdays 5 to 8 p.m. or my office hours Wednesdays and Thursdays 2 to 4 p.m.